my friends. I am Dr. Gaurav Singh Bhandari, Director and Unit Head at Dharamshila Narayana Super Specialty Hospital, New Delhi. Today we are going to talk about most common issue in the society, which is knee arthritis, and the treatment, which is knee replacement, what we call as total knee replacement. Knee replacement is something which is not new in today's world, and it has been done all around the world for past many years. Knee arthritis per se has high incidence of almost 2.5 to 2.8 CR, that's crore of people affecting in Indian population. Knee arthritis patients come to our OPD regularly with most common symptoms of pain, bowing of the legs, and difficulty in walking. And depending on the stage, the patients are advised total knee replacement surgeries. So we are not going to talk much about what is arthritis of the knee and how the knee replacement surgery is being done. But we are going to talk about most common issues or the questions the patient always come often to us in the OPD, whether what are the precautions we have to take before the surgery, during or after the surgery. So these are very common questions which are being asked by the patient. So I'm going to just break the ice and answer all those questions to you. To start with, we'll talk about the medical management. So you always have to discuss with your doctor or the surgeon which medications the patients are taking, like blood thinners, and you have to basically, the surgeon has to ensure whether they are safe before and after the surgery or not. Then coming to the second point is the infection. Dental care, which is very important. If needed, the patient always has to take the dental care before the surgery. The patient also has, if they are smokers, they have to stop smoking. If they are alcoholic, they have to stop doing alcoholic consumption, because these are in future after the surgery, they affect the wound care management or the wound healing. The potentials of the wound healing are hampered if the patient continues to take smoke or alcohol. The third point is the home preparation. The patient will need few assisted devices at home and accessible furnitures so that they are mobile and they should not come in the way of the patient mobility. So like a walker, a shower chair, a handrail besides the toilet seat or the WC. Then the fourth point is the transportation. Somebody has to be there with the patient before and after the surgery so that the patient is being transferred to the hospital and back to the home after the surgery, since the patient is not allowed to drive after the surgery for at least a period of 6 to 8 weeks. Then physical therapy, which is the most important part. We always tell patients to do regular physical exercises so that the muscle strength is properly achieved before the surgery, because it is said and it is actually proven the physical therapy or the exercises done before the surgery actually helps in early mobilization of the patient after the surgery. These physical therapies is not important for the patient that the patient has to stand and walk. We understand the patient is having pain. So when the patient is already weight bearing and there's pain, the patient cannot weight bear. In such situations or such circumstances, the patient is advised to do isometric exercises of the knee or the quadriceps muscle so that the muscle strength is regained before the surgery to an optimal level. Now coming to the precautions which are taken during the surgery. Number one, which is infection prevention. The patient has to keep post-operative area or the surgical wound clean and dry. The genitalia have to be cleaned every day. The patient cannot take bath. We do not advise the patient to take bath in the post-operative period till sutures are removed, but the patient can do a sponge bath. Number two is blood clot prevention. Pneumatic pumps, medications and mobility. These are important for prevention of blood clots in the legs and post-operative edema. So in such instances, you have to follow your surgeon's advice. Then again, third point is the pain management. You will be advised analgesics as per your blood parameters and as per depending on the patient's concerns, depending on the patient's parameters, the analgesia are wide variety, and according to the patient needs, they are catered by the surgeons. Physical therapy. Following physical therapist instructions is very important post-operatively, because the joint replacement are being done so that the patients are mobile from day one after the surgery. View of that, the surgeons always advise the patient to start moving in and around the bed or surroundings inside the house, so that the mobility is achieved early, the muscle strengths are regained again, and the movement of the joint is not hampered, and so that the patient does not land up in stiffness of the joint. Next point is activity restrictions. The surgeon will advise you not to put excessive stress on the new knee, such as in high impact sports activities or prolonged standing. The next thing is assisted devices like walker, canes, crutches. These help in early mobilization and getting out of the bed by the patient, and these will be always with an assistance of a physical therapist in the post-operative period. Mobility is very important. Mobility like small steps, avoiding pivoting on the operated leg or single leg, and also using non-skid soles or the shoes, so that the patient gets confidence in walking post-operatively. Sitting cross-legged, squatting, and always sit on a chair which has got armrest, so that when the patient gets up, they always take assistance of the armrest while getting up. This will also decrease the pressure on your knee, which is just basically a new knee, so that the patient does not have pain in the post-operative period. The next point, very important, is stairs. The patient always say, our house is on the first floor, second floor. So can we climb stairs? As a surgeon, we do not ask the patient to avoid stair climbing. If the patients are comfortable, they can climb stairs from the day one. There are only few precautions which have to be taken while climbing stairs. Important is always use handrail while going up or down the stairs. Number 2, when you are climbing up the stairs, always put the non-operated leg first to climb up the stairs. And while coming down, always the operated side first. Then most important thing coming is follow-up appointments. So never ever miss your follow-up appointments with a surgeon, because whatsoever is the new thing, the surgeon will advise you patient to patient basis. You have to follow that. So to avoid those missing notifications, always visit your doctors on a regular basis. Then next important is driving. Patients are advised to drive post-surgery, but only thing is you need to wait for about 6 to 8 weeks till you regain your muscle strength. And then most important is recognize your complications. If any time you feel there is increased pain, redness, swelling in and around the operated side or in the leg, or increased fever, do give a visit to your doctor, the surgeon, so as to understand these red flag signs which can be tackled at an early stage. So in a nutshell, these are the things, or these are the preventions which the patient should know before, during and after the total knee replacement surgery. If in any time a person has got any more questions or doubts, you should always visit your nearby orthopedic surgeon to clarify your doubts. But to tell you in a nutshell, knee replacement surgery is a lifestyle changing surgery, and this will only help to increase your mobility and decrease your pain and improve your lifestyle to do activities of daily living and enjoy your life. In the end, I would thank you for listening to me, and if in any case you have any doubt, please feel free to contact Dharamshila Narayana Corporate Call Center. Thank you so much.